Hello, my name's Chris Jacks. I'm the unit nurse educator here at Emory St. Joseph's in the ED, and today I'm going to show you how to set up the targeted temperature management that we use here. The one that we use here is the Blanketrol cooling system along with the CoolKit blanket system. Okay, so you're going to need the Blanketrol and the CoolKit. You also will need a rectal probe. All right, so the patient had been in cardiac arrest, they were resuscitated, or we can use it for hyperthermia if someone needs to be cooled down quickly. Once you get your kit, you're going to open it. Okay. Kit comes in 3 pieces. Okay. Then you've got your rectal probe. You've got your Blanketrol. You can go ahead and plug it in if you want to. Okay. All right. So the first thing you're going to put on is the headpiece. The headpiece goes under their head with the supply lines going to the top. So you would put it under their head like this. The supply lines going to the top. You can wrap the forehead piece around their head. Do not secure the neck part just yet. The next part is the chest or torso. In order to do this one, you may have to roll the patient. When you roll the patient over, you can then insert the rectal tube. The rectal probe. Rectal probe goes up as far as it'll go. To keep it in place, you may have to tape it to a butt cheek. Again, this is put up under the patient. These pieces go around on the front of the torso, or if you can't fit them around the torso, then you can wrap them around the arms. The last piece is a blanket goes around the lower extremities. You can lay it on top, or you can wrap it around their lower extremities, either one. Then, to attach them to the Blanketrol cooling machine, you're going to attach this piece. This is the rectal probe that you've inserted. This attaches like this. And now this does not show up on the monitor. This shows up on the Blanketrol under patient, their core temperature. Then you hook up all the supply lines. There should be 3 sets. You've got a black and white. It doesn't matter which one you put it on. You push it till it snaps into place. Again, each one, make sure it snaps into place. And then this third one to the head. Once you get that done, you're going to make sure you have enough water. On the back, there's an opening where you can see the sterile water goes in. You want to shake it just to see if the water is up at the grate that's in there. If not, you need to add more. Then you're going to turn it on. The on button is here at the front. You turn it on. It will, once you see check, set, PT, then what you're going to do is hit temperature set. Then you're going to set the temperature to what the provider wants, typically 32 to 34 degrees Celsius. Once you get it to the targeted temperature, then you hit auto control. Once you hit auto control, it automatically starts putting cool water through the blankets. Then you can, once the headpiece fills up, then you can wrap this around their neck. You don't want to make it too tight and constrict their airway or their carotid arteries. When you're cooling the patient down, within the protocol, they may need some sedation. It's built into the protocol, or you can ask the provider. Also, when you're transporting this patient, you need to, this stays with us. You just unhook it. So from each port of water intake, you push on the metal button, disconnect. Once you get them all disconnected, you disconnect it from the rectal probe. Just pull it out there, and then you transport your patient upstairs.